Do you say octreotide or octreotide?
Put the wrong emphasis on the wrong syllable.
Either way, let's get into it. So it's a synthetic version of a hormone that our body makes on its own called somatostatin, and it lasts a little bit longer. And we give it to patients with upper GI bleeds to help reduce blood flow to the GI tract. Well, how does it work? So it reduces splanchnic blood flow, just meaning that it reduces the blood flow to the GI system through modulating calcium channels, which causes an influx of calcium into those smooth muscle cells, inducing vasoconstriction. And then in turn, what we want it to do is to help reduce that blood flow so that these patients with variceal bleeding or gastric bleeding, we want to slow that bleeding down. Now, there is something you need to know about it. A lot of times we give a bolus followed by an infusion, and you've got to be very careful giving that bolus, because one of the side effects of this is that it kind of tampons down sympathetic tone, and we can have massive bradycardia. As a matter of fact, I saw this happen when I was a new nurse. I gave the bolus, and the patient immediately dropped down to a heart rate of 20 and was going, and had that impending doom. And boy, I put that crash cart on two wheels getting it to that room, and the patient was fine a few minutes later. I was talking to the attending. He asked me to call the pharmacist and ask them if they knew anything about it. And they said, yeah, actually, when you give that bolus, you can cause profound bradycardia. So make sure you're pushing that bolus super slowly and watching your patient very closely when you're giving octreotide. Or maybe you're one of those weirdos that says octreotide.